Hello, good afternoon. Hi, Darryl.
Hello,
Um,
Laura. How are you?
Fine, thank you. It is the 19th of June, and here in Germany, it is 5:10 in the afternoon. And we have here Darryl from Canada. So please, Darryl, let's just go ahead. You will be our sixth story in this series. So just tell us a little bit about yourself. So who you are, where you come from, and yeah, just give us something.
Sure, great. Yeah. So my name's Darryl Ricker. I live in Canada near Toronto, which is our biggest city. I work in the city, but I actually live in a small town outside of the city. I work in the software industry, and I've lived in Canada my entire life. I grew up in the western part of Canada. Now I live in the eastern part of Canada. So, but I have traveled kind of all over the world as well. So right now there's 8 people in my house, which is kind of crazy, plus a dog and 3 cats. So you can imagine in the lockdown time, with most of us 24/7 inside here, it's been kind of nuts. And in fact, even in the quarantine time, we've started to have wild animals because I live at the edge of town, show up like foxes and coyotes and skunks and things like that, which is kind of
It's a
crazy.
little bit
So
of entertainment.
yeah, so that's probably enough about me for now, anyways.
Okay, and tell me something, just one more thing about yourself.
Sure.
Since with the coronavirus pandemics, has there been any change from what you do? So were you doing something work-wise? Were you doing something different and now you're doing something else? Did you have to reinvent yourself or no?
Thankfully, I didn't. So I manage the Canadian office of an American software company. And the only difference in the COVID era is I do all that from home. So I was already accustomed to doing some work at home because my commute is a fairly big one. So sometimes I work at home. So it wasn't really that big a deal. And my entire team really, because we're all used to kind of working on our laptops and so on, we adjusted very, very rapidly. So I'm really fortunate to have that kind of work that I can do so easily. And having said that, because I'm the only person right now working in my house, it's kind of a little bit sometimes crazy to have 7 other people, having fun, watching Netflix, watching TikTok videos and video games. So that's been kind of a mental challenge for me, but I've buckled down and done my work mostly. So.
Okay, well then, yeah, like you said, you were lucky to be able to stay.
Very much.
But also it has maybe not as much for you, but it has been a struggle, a difference, right? From going to the office to suddenly not going to the office and having all the work at home.
Absolutely, absolutely. And then my family, my wife hasn't been able to work, and my kids, I've got teenagers and so on. They can't work. My daughter had to finish her university from home, so there was changes in my house, but personally, at least my job didn't get impacted too badly, which was nice.
Which was nice. And
Yeah.
now going more towards moving just for a little bit away from you. Tell me right now, what is it that is happening in Canada? What is the main topic that everybody's talking about, that the news are talking about? Maybe it's a concern, or just tell me a little bit, what is the situation in Canada right now?
Sure. I mean, I would say that COVID really is the thing that's kind of still the biggest news story, I guess worldwide, but certainly in Canada. A lot of us are still pretty much locked in our homes, and so that becomes a pretty good topic of conversation. We're starting to, by our provincial guidelines, we're allowed to go out, and sort of social distance from people. So starting to hang out a little bit on my deck and my front porch and stuff, but it's a weird kind of situation. So that's the most focusing thing. I think that having said that, a lot of Canadians are also paying close attention to what's going on in the US, not just their COVID situation, but the economy and of course the protests. So they're our closest neighbor. We watch that. We kind of, our hearts kind of break when we see some of the stuff going on. And it's very different than Canada, or very, very different. Canada and US are very different. There's, we don't have a lot of gun culture here. We don't have, I would say, that as much of the racism as there is in the States. It's kind of hard to watch. So, but I would say,
system. Sorry to interrupt. Your healthcare system is completely different, right?
For sure. So yeah. So a couple things have helped COVID here. One is we have free healthcare like a lot of countries do. So you can get in, and even though early on it was hard to get tests, at least you didn't have to go pay for it or worry about $100,000 bill at the end of it. If you got positive, like in the States, some people are getting multi-$100,000 bills when they're in there for 2 weeks and they're on a ventilator and things like that. So we don't have that concern. The other thing that our government, I'll credit them for this, that they did was they gave people $2,000 a month, not one time, but $2,000 a month every month that they're unable to work. So anyone who wasn't able to work gets $2,000. Students get, I think, it's $1,200 for students if they're not able to work for the summer. And that changed a lot about people's feeling pressure to go back to work. Whereas in the States, they got the $1,200 one time. Half of them, I think, or some portion haven't even got it. Yeah, it took a long time to get it. And it's been months now, and those people feel pressure to go back to work. So they go back to work, they're spreaders, they're afraid to go to get a test because it's going to cost them money. It's kind of a perfect storm for disaster, right? And you see the numbers, the results.
Yeah, this morning it was over 120,000 deaths, and it was almost 2.3 million cases that I saw.
Yes.
And
yeah, no, it's crazy.
It's crazy. And you are a big neighbor. You're not a small neighbor of the United States. And
Correct.
Yes, it's very different, but even looking at your numbers, you can't compare. What were the cases? I think.
Yeah, we have about 100,000 countrywide. About a third of those are in my province, which actually is the biggest province. Had just over 8,000 deaths, 8,300 deaths as of yesterday. So per capita, we're roughly about half on most fronts with the U.S. Not that the U.S. is a great country to calibrate yourself against right now. So there's things we could have done, and we'll talk about that we could have done better. But certainly compared to the U.S., the numbers are going down. Interestingly, you said about news. I mean, in my province specifically today, we're opening up a whole bunch of what we call phase 2 businesses. So hairdressers and so on. You can probably tell my hair hasn't been cut for a while. So, that stuff's happening literally today, starting in the province I live, which is called Ontario. So I'm a little on edge, and I think other people are, to see what happens out of that, because it could happen like in the States, where it sparks another kind of outbreak and things like that. So, but yeah, our numbers have been much better than the US, but still maybe not as good as we'd love them to be. So.
Could have been. And just staying a little bit longer on this topic, 2 questions. The first one is, you said hairdressers are gonna open today. Will you or a member of your family already go, or you are going to wait a little bit longer?
I know I have a nephew that lives with us. One of the 8 people in our house is my nephew who lives with us, and he has this crazy curly hair, and so he's going, I think, next week as soon as he can. I'm going to go a little later. We've been very careful. In fact, my family doesn't let me out generally, because I'm right now the sole incomer. So we go out once a week kind of thing for groceries and stuff like that. So we've been very careful. So we'll probably continue to be cautious about that type of thing. But I will at some point probably get my haircut. But I'll see how the early days go.
Okay, so still cautious, even if everything. Okay, that's good.
Yeah.
And the second question, staying with Canada and the US, could you just tell me the latest on the border? What is happening with the deal between Canada and the US border?
Sure, yeah. So we closed the border kind of mid to late March. I think it was the 22nd, I think, of March or something like that, where we closed the border to the US, unless you were a Canadian citizen. We kind of encourage Canadian citizens to come back. A lot of healthcare providers, we have a lot of what they call snowbirds, people that go from Canada in the winter to Florida and Arizona. They were told by their healthcare insurers to get the heck out of the US, because they wouldn't cover them if they got sick. So we had a huge influx back, but it was around, again, late kind of March. And then that's been locked down really all the way through. And it's opening up at the end of June. They're allowing, I'm not sure how much influx of people, but the current date is June 30th, and they'll allow you to come in if you've got, I think, an immediate family, so it would have to be a child or a parent in Canada. And I'm not even sure if you may have to provide some actual reason as well. Maybe you've got a sick parent or something, but I think at the minimum you have to at least be direct relations. So if I've got an aunt or uncle or a cousin, that doesn't cut it. And they'll still kind of, I think, still be pretty tightly restricted, because obviously the situation is not under control down there. We don't want to import that here.
Oh, so. Of course not. I mean,
yeah.
Look at what happened with New Zealand. New Zealand is still inspiration and a story of hope.
That's great. It's awesome.
But they, after I think 26 days of 0 new cases, they suddenly had 2 cases in one day, and they were imported cases. There were people, residents of New Zealand, that came from Europe, and unfortunately they were supposed to stay in quarantine, but they got permission to just go out of the premises, and it turns out they were positive. So it really only takes one exception, right? To
literally one person, yeah.
One person. So I hope the border holds like what it needs to be.
I do too, and I have lots of American friends and family and coworkers. I would love them to come up here, and people online are always asking me on, can we come up to Canada? Like, people don't know me, but yeah, as much as I like many Americans, I don't really want to bring a pandemic up here. So,
Yeah.
or more of a pandemic.
More of a pandemic, no thanks. And you already told me a little bit, but maybe there's something else that you'd like to talk about in terms of just the first measures. Like, so what was it that Canada did in order to stop the spread of COVID-19? And if you remember the dates, when, and also what you were telling me earlier, that there were some things that could have been done better. So just give us an idea.
Sure. Yeah, I'll talk to that. So I made a couple notes about dates and things, but sort of in early January, our chief public health officer, whose name is Dr. Teresa Tam, she's kind of our Dr. Anthony Fauci, if you will. She warned people going to China, not coming from, but going to China, about a pneumonia of unknown cause in Wuhan specifically. So that was as early as, I think early January was like the 3rd or something like that. By late January, we had kind of a very light screening protocol, basically just sort of saying, if you've come from the Wuhan, area, we recommend that you voluntarily quarantine yourself. So I say very light. I mean, no kind of teeth to that. By the end of January, of course, the WHO declared it a global health emergency, although not a pandemic yet. But through February, we were still doing that voluntary quarantine piece, and so we still had people coming in from Italy and China. There was a little bit of temperature screening at the major airports, so that's Toronto, Vancouver, Montreal. I think were the 3 main ones, but it was very, again, still very light. By mid-March, we actually had our first, end of February, we had a case or 2 from, I think 4 actually, by the end of February, directly from China. All of them had come from China. Okay. Canadians who had visited and come back. By mid-March, we had our first death. And then also mid-March, the WHO declared a pandemic. So, and actually, ironically, at that time, our prime minister, not him, but his wife, got it. She had been to London, I think, and came back and had COVID. So I think that was helpful in the same way that Boris Johnson getting it was helpful. Kind of made it a little more personal for the prime minister. And I'm sure everyone knows our prime minister with his great hair. So I think that helped a bit. And really within a week or so, we had restricted all international flights. I think it was March 22nd or something like that. And closed the U.S. border, mostly again, except for Canadians coming back. So, but I think because of that delay in closing the border, there's a bit of controversy here. Our numbers are higher. Like I said, we're about half in a lot of cases the U.S., which is not anything to brag a lot about, but it's better than the U.S. The good news is Canadians are very compliant. There hasn't been any confusing messages from our leadership. So our prime minister and what we call our premier, which is the head of our province, state, if you want to think about it in U.S. terms, the kind of like the governor, essentially. Not all of them are giving the same message, the consistent message of social distance, wear masks, be smart. And Canadians in general are very compliant people. We're very kind of, you tell us to do something, we just do it. We're very, I don't know if that's a good or bad thing, but so people are, when I go, people are practicing social distancing, they're wearing masks. We were also a hotspot in 2003 for SARS. So some of us remember that. We remember that. So it's gone pretty well. And our cases are going down. Daily cases are going quite a bit down. So.
I mean, it is one, at least what I have noticed from the very beginning since January, is one of the biggest faults in most countries that have not done well, or as well as they should have or could have, was communication indeed. Just transparency from the beginning. We give the sense of trust and that we are doing this for you. And from what I saw, Canada did have that.
Yes.
Just well, but also I think, correct me if I'm wrong, maybe it's a stereotype that I have in my head that it's completely wrong, but aren't Canadians also very altruistic, or am I wrong?
Yeah, I think so. I think you'll see that Canadians, relative to other countries, particularly our neighbors to the south, are I don't want to, I'd be careful how I say this, but nicer, more thoughtful people as a rule. Kind of, we have, as we talked about free healthcare, we have much stronger social safety nets for people who, are out of work or having struggled, getting work or whatever reason. Those people aren't destitute in the way that they are in the U.S. so we're a little more compassionate. We're more socialistic, if you will, and so I think that kind of plays into our personality as a mass of people. I think we're generally thought of in the world. People put the Canadian flag in their backpack if they're traveling to Germany or Italy or wherever, and people always smile because it's a Canadian. Like I think most of us are fairly nice.
Yeah,
we're not perfect, but we're
nicer
nice.
and nicer, and so think more of the others of your
Right.
community, which it's the best thing for us, but it's the worst thing for a pandemic, right? A pandemic loves
Yes.
when you don't think about others.
Yes. Oh, of course. Yeah. Yeah. Which is happening obviously in the U.S. You see that. So.
In the U.S. and in too many places.
Right.
But okay. Thank you for this. Now let's go back a little bit to your story. So we do a little bit of a jump. Can you tell me, so you have been aware and you were aware from quite the beginning from what I can tell, but is there perhaps like a moment, maybe there was a specific story you saw in the news or either something that happened in Canada or outside, but a situation or something that happened that made you realize that this pandemic was actually, that it was a pandemic, that it was something more serious than you thought or everybody thought? Just when was it that it hit you, let's say?
Sure. Yeah. So, I follow politics very carefully, particularly for reasons I probably can't even explain. I follow US politics probably even more than I follow Canadian politics, although I follow both. So I was following the early news about the coronavirus and how it was being dealt with, stateside mostly at that time. And at that time, I kind of started doing my own research about what this thing was, right? And again, we'd been through SARS, we were here for H1N1 and things like that. So I had some remembrance of sort of previous contagious things, and so as Italy started to blow up particularly, and China, of course, I started to investigate the mathematics of the pandemic. So my background is in mathematics, and I work in software, so I'm a computer guy, so numbers and algorithms and stuff kind of fascinate me. So I started kind of trying to understand that. I'm not an epidemiologist, I'm not a scientist, I'm not a doctor, but I get the numbers. So I found a couple of really good websites. I'll maybe send you some of the links, but like the New York Post had kind of a really interactive website you could play with. How long are people in a social distance and things like that. Washington Post had a good one. There's a few others, and I started to download the data. There's Our World in Data, I think is ourworldindata.org, I think is the website. I downloaded the data from that all the time and just play with the numbers. But when you see the epidemiology kind of math of the R naught, or which is basically the contagiousness of the disease, and just start playing with that, and you see the exponential stuff, and people don't understand exponential stuff, and it's just when it goes like this, it's still and we've seen it. You look at the numbers, it's an exponential curve, but no one understands that we only have 15 cases that can be down to 0. We heard that, right? Kind of thing. And even in Canada early on, they said, oh, there's only 4 cases, we're pretty safe here, but they don't realize it's like New Zealand, that one person who comes back all of a sudden seeds, and you've seen the numbers. And so it was playing with those simulations that I didn't write, but I was using. So I went, oh my God, this is crazy. And understanding that for this particular virus early on, all those numbers were higher. The R naught number was higher, and how you could get it in terms of asymptomatic cases, and how you could be asymptomatic for 2 or 3 weeks and still give it to somebody. And I started to understand from a math standpoint, this is terrifying. So, and I'm not as old, or I'm not as young as I used to be. I had some health issues last year, so I started to get a little concerned about myself personally, and then in turn, of course, my family, both for them individually, and then if I got sick, or some of the worst outcomes that come of obviously are worse than getting sick, I'm thinking, oh God, I'm the primary income earner in my family. So that's when I took it very seriously really early on. And I was also frustrated that, especially when I look at the States, they didn't take it. And I was just watching that and thinking, oh my God, how can they not take this seriously? It's math. So that was kind of where
20 months, they still don't. Sorry to interrupt.
Yes. Oh no, you're right. Yeah.
But in Canada, you don't have that problem, right? Like, at least I assume most of the population, if not all, they understand the severity. Like, there's no more
They do. I would say by and large, yes. There's definitely people that don't. There was a bunch of pictures maybe a month ago posted on a beach opened up in Toronto, and it was crowded, right? Or it was a park, I guess, but it was crowded with a whole bunch of people, and mostly I would say young people. But I say by and large, I think Canadians are acting very differently than what we see the Americans doing, which is like just going back to normal and crowding and and going into bars and beaches, and yeah, it's pretty good, I would say.
Okay, at least that. I mean, it's a pity to look at your neighbors and not be able to shake them, but at least you can feel safe that you are in the right side of the border.
Right.
No,
As
that's
long
not
as
helpful,
they keep it closed. No, it does. But again, that comfort is kind of, again, because I have friends, family, and coworkers down there, it sickens me to watch what's going on. And it's not, that people talk about like the Oklahoma rally. Like, it's not just the people that go to the rally in Tulsa that are at risk. They come out, they in fact infect their friends, family, elderly people. They go into healthcare situations and impact doctors and nurses and orderlies and all kinds. I mean, it's not just them. If it was just them, I think people wouldn't mind them going into some arena in Tulsa, Oklahoma, and
your own
getting
thing.
infected. Right.
Exactly. That's why even from at the beginning, I would get so frustrated because people, obviously, after a while, you just don't care anymore. You're upset and you say, you know what, do as you want. But they kept on, even now people keep on saying, oh, you know what, just leave it. It's Darwinism. But it's not,
It's
because
not at all.
it's not at all. If it were, like you said, okay, that's another deal. But here it really affects everything and everyone. Like you, I've had a big interest in the States. I don't have that many friends and family. I do have some, but mostly because having been brought up in like American environment, even at school, I was taught that the US takes the lead in any global crisis.
Sure.
The US are the ones that will, let's say, save the day, lead by example. And I am half Bolivian, so I always thought, my God, you're giving such a bad example to Latin America. And as you know, Latin America, they look up to the States, whether they want to or not, they just do. So I don't know, it was heartbreaking for how the US reacted and acted to this pandemic. So, and it does affect everybody in the world in the end.
Absolutely.
But leaving the US aside, going back to you and Canada, now that we've spoken about your story, so who you are and so on, and also what's going on with the States, with Canada and the States, tell me, what are your hopes? So what are your hopes, your concerns with Canada? What do you think, based on what has been happening lately, on the fact that today so many you're moving faces and so many things are opening up, what do you think is going to happen in the next few days, in the next weeks? What is it that you don't want to just tell me your predictions, let's say.
Sure. I mean, my hope, I think, like everyone, is that we find a vaccine as quickly as possible, before we have to get herd immunity kind of the bad way, right? But my concern is, and I see it, here in Canada, people are getting restless. I see it more so in the States. People are tired of being locked up and restricted. And they want to go back to normal. And I've got kids, and they want to go back to normal, and they're eager to go hang out with their friends. And then we have to kind of hold them back a little bit. It's tough, right? And as I mentioned today, is a day a bunch of things are opening here in my province. So we'll see what happens. It does worry me that we're going to have another spike. And if we have another spike, we're kind of back to square one in a lot of ways, right? Which I think is what some of these, rogue states in the US are going to see as well. So I don't want to have the entire province to go back into shutdown mode. So I want people to be, my dream or wish is I want people to be kind of smart, realize this is a once in a lifetime thing. It's hard to convince, especially kids who are 12 and 15 and 20 or whatever, that this is a once in a lifetime thing, because their lifetime is short, and they're the part of this kind of more adultish kind of lifetime is almost minimal. So, but even for people who've been around 100 years, they haven't seen this, right? You have to be around 102 years to see the Spanish flu, right? So, it's we have to conduct ourselves differently because it's that kind of once in a century or more thing. We have to accept that we have to do things differently than we do for anything else, and it is different, but it's okay to be different. So I hope people can kind of get that, but I have a bad feeling in a lot of places it's going to take a downturn to trigger that in people to go, oh yeah, this is really bad. So
are you talking about Canada or in general?
I think in both. Like even though I'm saying people in Canada are acting more intelligently and more kind of cautious than they are, but if today, everyone goes and just says, hey, like I can go to, restaurants, and I can go get my hair done, and and they just go back to normal, and they start hanging out in their patio, and they start inviting people into their houses and having parties, and, all of a sudden we're back to square one. So, but yeah, in the States, it's obvious because you see the videos of it, but I think here there's a risk here too, right? People were tired of as much as previous generations did crazy sacrifices, you know, for World War One and World War Two, and like our sacrifice has been having to sit home and watch Netflix, but people are tired of that, right? So
especially in the end, of course, there is a difference. And when we speak about staying at home, we speak about the privileged, right? The ones that can afford to stay at
yes,
home, can work
it is
from
a
home.
privilege. Yeah,
And in the end, it is those people, so it is us that should do it even more in order to help the ones that can't, right?
exactly, exactly.
And yeah, I'm with you. I see it also, it's everywhere. So hopefully it's your hopes that come true and not your concerns.
Yep, exactly.
And to finish off our conversation, I have one last philosophical question, let's say.
Sure.
And that would be, if you could give a message to yourself. So if you could give a message to the Darryl in 14 days, what is it that you would tell him?
Okay. I think I would tell him, and I probably would go back in time even further, but just to enjoy the break from the commuting and the crazy random shopping trips, you know, 3 times in a weekend, and or you know, and just enjoy the time with the family and get outside more. Spend less time on Twitter, probably. You know, remind myself how fortunate, you know, I am to be able to work and provide for the family. I really, several months in, I still haven't really adjusted as well as I should have. I work too much. I'm stressed out about work. I'm stressed out about COVID. I'm stressed about the protests. So I haven't really kind of just taken a breath and gone out and enjoyed, you know, everything. And so maybe 14 days from now, I'll be able to have a different take on that. But that would be kind of my hope, is it? And I should have done that 3 months ago, but I'll tell my future self to enjoy this situation more.
To enjoy it. Okay. Well, thank you very much, Darryl, for
Oh,
this
very welcome.
wonderful conversation. It was the topic very interesting and heartbreaking, but it was really a pleasure to be able to understand more what has happened, what is happening with Canada. And on that note, we will see each other in 14 days.
Fantastic.
So we see what has happened in between. So
thank you. That was a lot of fun. So thank you very, very much for inviting me, and I really enjoyed it. And we will talk again in 14 days.
yes, see you. Thank you.
All right.
Bye,
Thanks.
Darryl.
Okay. Cheers. Bye-bye.